Good morning, everyone. Thanks for joining us. For those of you who may be new to the Alliance, just a quick introduction. The Manufacturing Safety Alliance of BC is the not-for-profit health and safety association for manufacturers and food processors across the province. We invite you to call us for confidential help with your safety program and training. Visit our website for training and resources or for information on the Occupational Safety Standard of Excellence, which is core certification for manufacturers and food processors. Today's webinar, we're really beginning to see that the workplace changes we're making to interrupt transmission of COVID-19, from physical barriers to staffing and policy changes, can have unintended consequences for employees at work. Today, we've invited a health scientist to walk us through the reasoning, requirements, and potential consequences of the physical barriers now being used in many plants and other workplaces. And our Alliance ergonomist will also be joining us today to introduce some important considerations for addressing workplace design flaws to reduce the risk of new MSI injuries and fatigue. Joining us today, Dr. Angela Eykelbosh is an environmental health scientist and knowledge translation specialist with the BCCDC and the National Collaborating Center for Environmental Health. In response to COVID-19, she and her team are gathering and synthesizing public health evidence to better understand the risk of disease transmission in indoor environments, including homes, workplaces, and public settings, as well as tools and strategies to mitigate this risk. And Dr. Poddar is a certified ergonomist at the Manufacturing Safety Alliance of BC. She has experience in ergonomics and human factors consulting in multiple industries and governments around the world. And in addition to a PhD in industrial ergonomics, she holds an international general certification in occupational safety and health. To briefly introduce today's webinar, welcome, Dr. Poddar.
Hi, good morning. Thank you, Jennifer. As we all are kind of fighting back to our workstation now, and COVID-19 pandemic led us our workstation, our workplace completely changed. We are overwhelmed with the need of frequent sanitization, maintaining social distancing protocol, and also companies are dividing the workforce between work from home and on-site or field. So there is, of course, a rising need to understand ergonomics principles and application to address the new challenges. So we are here to kind of address that issue, how we can smartly redesign the workplace while we are kind of adjusting to our new normal. So a little bit of background on this. Basic needs or background challenges we have at this moment, how to minimize the exposure to COVID-19. And some of the industry is coming back and resuming work after a period of closure. However, there are companies like manufacturer and food processors, they were already working. So either full-fledged, they're starting working, that's the new challenge under this new challenging scenario, as well as they are also fighting or operating under the stress of increased demand at times, especially food industries. And they also try to cope with a high rate of absence at times because people are still uncomfortable going back to work. And obviously, management are trying to control number of people on site and dividing them, and managing worker who are working from home. So these are the basic challenges we have at this moment. So considering this, our regulators like WorkSafe BC here in BC also had led new guidelines. And so while we do that, the basic need is to they identified basic needs like maintaining a distance of 2 meters between workers wherever possible, by revising work schedules, organizing work tasks, posting occupancy limits on elevators, and limiting the number of workers at one time at a facility. However, with that, these all being done and kind of regulated, the main focus is to kind of safety, personal safety, as well as overall safety of the hoods. However, with these changes, there are few new set of challenges which we are facing at this moment. So I will hand it over to Angela to describe the basic background scenarios, what we're having at this moment. Over to you, Angela.
Thank you.
You're welcome.
All right, so yeah, great, that's the slide. So thanks, Sarah. As mentioned, I'm from the National Private Center for Environmental Health, which is actually funded by the Public Health Agency, and it's hosted right here in Vancouver at the BCCDC. So if you haven't heard of the NCCH before, then you should know we were actually founded in 2009 in response to the first SARS outbreak in 2003, during which it was realized that there was a real knowledge translation gap, capacity gap in Canada. So our organization was created to do that kind of evidence-based knowledge synthesis and translation, to communicate that to knowledge users, to identify knowledge gaps, and to be active in fostering networks and building capacity for our public health system so that when the next outbreak happened, ta-da, we would be ready to be sharing information in exactly this sort of fashion. Next slide, please. Great, so I'm going to be talking about barriers today used in the workplace because I did a little bit of work on them for the BCCDC. So to give you a full rundown of everything you need to know, I'm first going to talk about just generally what we know about COVID transmission. Then I'm going to talk to you about the work I did on collecting info and best practices for design and installation. I'll also point you towards the current guidelines and the requirements for barriers, just very briefly, because there's actually quite a lot that you may have to review depending what sector you're working in. And then finally, we'll touch very briefly on cleaning, and then I'll speak to some of the potential unintended consequences that have come to my attention after having done some of this work. Next slide. So, COVID transmission, you're going to be very sick of hearing this by now, but I'm going to pose this in a slightly different way to make it a little bit more understandable for why we do barriers. So COVID is just primarily transmitted by either inhaling somebody's particles. I'm not going to say droplets or aerosols because those are not useful distinctions. By inhaling somebody's particles or by getting those particles on your hand and then touching your face or your eyes. So as you may have heard in the media, humans are just constantly generating these particles all the time, but some particles are much more risky than others. We generate particles when we're breathing, when we're speaking, singing, shouting, laughing, sneezing. However, those quiet activities tend to produce fewer and smaller particles, whereas the loud, energetic activities and exercise even tend to produce larger and more particles overall, including those small ones. So humans are particle generators. Here's what's important. The heavier a particle is, the more likely it is to carry one or more viruses. But those heavy particles also travel shorter distances. So our risk reduction goal is really to focus on those large particles, the ones that are most likely to cause disease, and to try to prevent people from inhaling those. As with any kind of exposure, so any kind of toxic gas or any other potentially bad thing, your proximity to the source, your closeness to the source, and the duration of the exposure are the key factors in how likely you are to have a bad outcome, in this case, getting COVID. So aerosols, there's been a lot of discussion in the media about the role of aerosols in COVID-19's transmission. So an aerosol is just another name for the very smallest kinds of particles, the ones that don't settle out, but instead tend to float around the room. We've looked quite extensively at the epidemiological data, and what we're seeing is although there might be a role for short-range aerosol transmission, it's usually because there's been a really serious ventilation failure. There's absolutely no evidence that COVID travels through HVAC systems to affect distant locations. Okay, those are two really important things to know. Next slide. Oh my goodness, I'm missing a slide. Okay, well I had another diagram there, but it's all right. Yeah, it's just not there. It's okay. We'll just move on. So the purpose of the physical barrier is really to shield the breathing zone from the largest and the riskiest droplets. Okay, so in order to get some kind of background on the best practices for design and installation of these barriers. Oh, no, back up. Hang on. I actually went out and I talked to a bunch of manufacturers who are actively producing tens of thousands of these barriers. And I also, so I gathered that information together and then I ran it by a big group of public health people to kind of get their input on what would be the best practices. So the general consensus or the outcome of what we're trying to do is we're trying to protect the breathing zone, shield the breathing zone of the worker. And that breathing zone is defined roughly by a radius of about 30 centimeters or 12 inches around that person's nose in every single direction. So think of it like a big beach ball on somebody's shoulders. We're trying to shield the beach ball. And so the considerations for design and installation that came out of that information gathering project were actually quite detailed, and we have a very long not very long, we have a moderately long document, 3 or 4 pages, that is available on our webpage, and I think that Jennifer will be sending out a list of external links, and that is on it. So you can read the full document there, but the basic things were the obvious, to consider seated and standing users. So we have lots of situations where people they're quote users of the barrier, but one may be sitting or one may be standing, or they may change positions over time. So the idea of those barriers is that you need to be shielding the breathing zone of the tallest and the smallest people that are both standing or seated for most of the time. So you don't need to like protect everybody in every potential position that they could be in, but you do have to try to protect their breathing zone in the way that the barrier is normally being used. The next thing is thinking about stability of the barrier and whether it can fall over and hurt somebody or overbalance a table. I've seen lots of designs where they're either freestanding and they're not secured, or they could impede egress if there was some sort of emergency. That was a really big concern. There's some large freestanding barriers that the wind will blow over. So, you know, there's a lot of kind of like it's a bit of a wild west of design out there. So you really need to be thinking about safety with these, and that they can actually be secured to the surface, and they're not going to potentially cause another hazard. So airflow is also important. The entire purpose of these things is to prevent the breathing zones from 2 people from intermingling. So we need to not have airflow between them. So one big issue is the placement of the slots. So I saw one, I think it was for a dentist office, where there's somebody seated behind the barrier, and they're accepting papers from somebody standing behind, but the slot is right at the person's mouth. It's right in front of the seated user's face. So that's obviously not going to work, which is why we're telling people to place them off to the side, but then of course that requires people to be leaning and reaching, which, as we know, is not necessarily great if you're doing it 50 times a day. But also I've seen lots of designs that incorporated speaking grates, which is obviously defeats the purpose. Don't put speaking grates in these barriers. That's not what we want. And the other issue is wafting. So a lot of places, because of the kind of work that they're doing or what they have to work with, they've been hanging large sheets from the ceiling. And so that's okay if they don't move a lot, but if they're actually able to move with the wind or because of other factors, they can actually waft the air back and forth underneath. And then of course you're just joining the breathing zones again. So you've defeated the purpose. The other thing that's come up a lot is the ease of cleaning. So there's a real preference for rigid barriers over flexible because they're easier to wipe down. But there's going to be some situations in which a flexible barrier it could be considered, let's just say. Next slide. So the current guidance in BC is what we call outcome oriented. The outcome is to shield the breathing zone of the users. And what we've tried to do is give operators flexibility to create partitions that achieve that aim without getting in their faces too much. That said, every single workplace needs to develop their COVID safety plan, and the construction and design of these barriers is a big part of that if you're required to use them. And so there may be requirements for you to follow. So Jennifer, one of the other things that she'll be sending out are links to WorkSafe BC. They have a designing effective barriers document that came directly from my work. And there's also a link on there to the PHO is the Office of the Provincial Health Officer, which is Dr. Bonnie Henry, the lady in the pink shoes. That website has a full list of all the orders that have come out, and it's really worth just taking a look at it, because I think a lot of people don't realize there's been quite a few orders that have come out. They may affect your sector, your business. You should just review that to make sure that there's nothing on there that affects you, because those orders are orders. They are the law. You are required to follow them. So yeah, next slide. So I'm not going to say too much about cleaning and disinfection, except to say that the most important thing, which is that if the barrier is there intercepting people's particles, it is a particle collector. It's a particle collector. You have to clean it. It's really, really important. So if the barrier is not touched by anybody, it's just intercepting particles and it just needs to be cleaned once a day. as other kind of like surfaces in the environment. But if you've installed some sort of thingamajiggy where people are touching the barrier, like I know some people put little slidey doors across the slot to open and close. Some people put a flexible flap in the slot so that people are passing their hand, they're touching that. If you've created everything or anything where somebody needs to touch, it's now a high touch surface and it has to be included in your schedule of cleaning for other high touch surfaces like all the doorknobs and the elevator buttons and stuff like that. So yeah, they do need to be cleaned is the important part here that I'm trying to communicate. So use appropriate products. For the most part, your manufacturer can guide you on what products to use. I know that there's some proprietary products that are like, they're more about cleaning the cosmetic appearance of the surface. Those aren't, it's not a cleaner and it's not a disinfectant. It's like Novus or something like that. So be aware that there's a difference between cleaning, which is just like, you know, getting a streak-free shine, and actually disinfecting something. If you've got a high-touch surface, you need to disinfect it. And you need to be also careful about what product you're using. I know that there's some very high alcohol cleaners out there that can damage acrylic surfaces. I think some ammonia-based products can damage acrylic. So you need to do a little bit of research, test it on a small area, but make sure that you have something that is actually adequate to clean and disinfect that surface, especially if it's a high-touch surface. Okay, next. So some of the unintended consequences here are, first of all, people not addressing the crowding. Okay, so some people have looked at these barriers as a way to just get more people into the space. That's not what barriers are. They're supposed to do. They're supposed to be used when social distancing absolutely can't be maintained, but it is expected first that crowding has been reduced in the space. So you need to reduce the crowding. And then for the people that need to be there, you need to, and they can't maintain a 2-meter distance, then you use a barrier. And then if all else fails, there's masks. So first deal with the crowding and then barriers for the rest of it. The next thing that's happening is that there seems to be almost like an over partitioning, this idea of boxing people in, which I just find absolutely bonkers. If you look at this picture here, this is a restaurant on a patio by the water in Denmark. It's outdoors. There's no need for those little greenhouses around the people. That's just making them hot and uncomfortable. And if one person inside that box has COVID, you're pretty much guaranteeing the other person's going to get it because you're trapping their particles in the same small space. So in this environment where it's a patio, it's open air, there's plenty of distance between the tables, that boxing in was just not necessary. And that kind of speaks to my third point. I'll just jump to that, which is about ventilation generally. So there's been some concerns that the hanging barriers, the ones that are, or very high barriers that reach up high into the airspace of the room, but those could actually be impeding mixing ventilation. That's not something we want. Basically, these partitions are protecting people from droplets, crossing workspaces and intermingling with other people's breathing zones, but they don't prevent you, or they don't protect you from aerosols. Aerosols, if they are produced, are kind of floating high and they're moving up, and those are not a disease risk because, again, they're very small. They're not carrying a lot of viruses like the big droplets are, which is what we're trying to prevent people from contacting, but we don't want them to build up either. We want to clear them. And so one concern that I've had is, you know, not over partitioning the space so that the air can't flow anymore. One of the other issues I've already mentioned is this idea of speaking or reaching around the barrier. People are, they don't like to have something in their face when they're talking, so they tend to lean around. One of the things that one manufacturer is doing is she actually printed a bunch of stickers, and she just gives everybody a sticker that says "Stay behind the barrier," and you know that seems to work well. People's attention are drawn to it. And then finally, it's really just generally how these barriers are affecting how people use their workstation, and in fact how people are moving around the environment. You can't lean over and talk to somebody anymore. You got to kind of get up and like walk around and then stand 2 meters away. So Era will talk a little bit more about that. Over to you. You're on mute.
Era, you're on mute.
Apologies, sorry. So it brings us to the existing challenges, what Angela just described. And when opening up the facilities or coming up with the of full-fledged operations or whoever was still working, like manufacturers and food processors. The basic challenges that the management is right away is how to strategize this return to work. So basic key points they are trying to do, like guided by or regulated agencies, whatever guidance we're getting, is managing transmission and frequently manage that cleaning protocols, which is now in place. While doing so, they also have to manage and divide the workforce between work from home as well as controlling the number of people on site. At the same time, they are kind of trying to manage the altered production rate. So at times the production rate gone higher during this pandemic situations, like food processors, for example. Also at the same time, they are trying to manage the equipment. So while doing so, it is utmost important to maintain the communication, because you are changing the work methods at time, changing the work design. So given this situation, it's even more important to consider ergonomics and human factors and include that within the new work designs. So while talk to that, I'll just briefly go about, as we talk in ergonomics, as IEA kind of according to the mandate. Next slide, please, Dale. So we talk about human factors and ergonomics interchangeably. So when we are redesigning these work methods or repurposing our facility, it's even more important to consider the human limitations we talk about in ergonomics. We're focusing into optimal operations and controlling and maintaining overall system performance. So that's being said, we'll just briefly see how human factors and ergonomics work. Ergonomics affects the work design. Next slide, please, Del. Yeah, so there's a little real value to human factors and ergonomics in this world of work, where while we are trying to redesign, repurpose our facility, as well as trying to segregate people among how many people on site and how many we are kind of maintaining for working from home. So this set of different challenges we are facing. So it's even more important to kind of take a participatory ergonomics approach in this, because COVID has introduced us to a new set of challenges. We have to maintain that safe distance between us. Next slide, please, Jill. So we have these typical challenges at this time, as Angela also was trying to point out. So we already altered the job. We already altered the production rate, as well as physical distancing is under like 100%. We are trying to do that to control these virus contamination. So definitely it's affecting the overall performance, and people are kind of a little bit scared to go back to work. So that psychophysical aspects also affecting. So it's even more important to include this human-centered design approach while doing so. Next, please. Yeah, there are some examples I'm going to share with you. Few of our members had done at the beginning of when pandemic hit. So we can see that there's a barrier introduced here to separate two individuals while taking lunch. You can see more of those kind of things. Next slide, please. Yeah, here where there was not possible to kind of maintain the physical distancing, introduction of these kind of barrier kind of help them to segregate from one another in the production line. Next, please. Yeah, here also you can see several engineering control has been introduced in between employees to maintain that physical distancing. Now the question is, how much time did they exactly got when they have tried to introduce all of this? Because that time industry was really going into a war footage to control this virus and contamination of this virus, and the knowledge of the virus was still coming in. So whatever we are doing at this moment, while we are trying to return to work in a normalcy or close to normal, definitely we need to include this participatory human factors approach. So while we try to change or introduce any shield or any other alteration of methods or work design, it's definitely more important now to consider the type of work being performed on that facility. Whether the posture has been altered or not, that has to be really taken into considerations. or other factors, right, like reachability of the individual or the group of people, or whether there is enough clearance has been given to the individual to operate optimally. So those are the basic things we definitely need to reconsider under such circumstances. So it establishing more and more again that it is important when we do change or alter any workstation design or changing the work designs. So next slide, please. Also, as Angela was mentioning, in certain situations where people had to kind of communicate to each other, so or introduction of the new barriers around you. So whenever you do that, we have to reconsider the zones. So work zones, definitely there are other considerations like what frequently used stuff to be kept close to your body. So these are the important considerations while we're trying to alter the workplace at this moment. Next one, please. As well as there are body planes, we operate with that. So that is constant, we cannot change that. So whenever we are trying to include all of those new inclusions in our workplace, we have to consider these things. We don't have, I mean, definitely it is even more important when we are operating under such stress. And there is also a psychophysical aspects of it. As I mentioned earlier, when people have that perceived threat of virus infection happening in the workplace, or every one of us kind of operating in that under that threat. So it's now even more important to consider all of these considerations while introducing this kind of barriers or any other inclusion or alteration of work design. Next one, please. COVID-19 actually give us a scope, and it will change our workplace forever, or maybe for good. We never know that. There are several research which has been shown, which is definitely not kind of conducive enough. The existing office, what we have is not conducive enough for social distancing. So maybe this is a scope we could use as an opportunity to build workplace for the future that are responsive, flexible, resilient, and most importantly, human-centered. Now we are segregating people, controlling number of them on site and some of them working from home. But in the long run, we have to redesign workplace considering this pandemic situation, because whatever research is done, it seems like it's going to stay for quite a little while now. So a holistic approach is more encouraging to see. So while we are changing this workstation design or workplace activities or work designs, we definitely need to take this holistic approach of physical aspects of work, where definitely reachability or other things, as well as these cognitive aspects of work, which were there definitely when you are in under stressful situation, it's even more important to consider that. And there is a socialistic or collaborative aspect of the work. So generally, we do this collaboration on site and general work situations. However, under these circumstances, it may not be fully 100% possible, but there could be other ways of using it, like this virtual environment and other different ways. So whenever we are changing the work design, or including any new like Shield, any new product in the workplace, we can consider all of these, which will ensure more optimal environment for people who are working there. Next, please. So these may be the new normal for future. And if we go forward, there are other research which has been found that definitely social distancing has to stay. And it is definitely time to rethink the office design. So this is a kind of proposed design, you could say. The contaminant barriers can provide a microenvironment which protects the employee for contamination from each other. So that's way forward. Maybe this is one of the solutions we are looking at. To sum up with all of these, we can, next slide, please. Also, the ventilation is even more important. That's Angela pointed out. To lower the risk of COVID-19 transmission inside building, increase ventilation and increasing airflow will definitely is way forward. and there is checklist available on MSABC website. You can access them as well. Next one, please. There are some probable solutions we can discuss now. The research, there are some research available which shows that EVGI in offices and facilities could control some of the microbial infections. Though this is a kind of probable solutions, WorkSafe DC and other regulatory authorities working on to coming out a full-fledged direction on this. Maybe creating micro environment for each employee to contain the spread is maybe one of the way forward, which will have a self-cleaning technology, definitely more fresh air, as well as for now we can use UVC task light to remove respirable particles. So there are other self-cleaning technology already available for frequently touched surfaces. And as we have seen that, or several research already shown that effective airflow system also helps to clean the this kind of microenvironment quite effectively. Overall, flexible work design has to stay. So we have to definitely control the number of people on site, and working from home is here to stay. That we have to strategize effectively so that we use them properly for future work design and workstation design. Next, please. There is obviously the light at the end of the tunnel. So COVID-19 can be managed till we get a vaccine and other method to control it. Existing, we can definitely manage it with clean air, protective ergonomic furniture, equipment, and good strategy, clean and sanitize environment. Thank you. That's to summarize. Thank you so much for your patience. Any question you have, you can shoot us. Thank you.
Thank you so much, Ira and Angela. That was a lot of information in a very short time. So I want to invite our audience again to continue to ask questions through the chat window while we have our presenters here to answer. And a brief reminder, just as those questions are coming in, for help with your COVID-19 safety plan, or any other health and safety questions, please call us at the Alliance anytime to talk with a safety advisor and take advantage of our support to build your safety program and train your people. As we start the Q&A, to help boil down that last topic on ventilation concerns, I see we have a number of questions coming in around this for employers. Angela, could you provide any additional insight into the latest recommendations for employers in terms of ventilation systems and upgrades?
Sure. Well, there's a ton of information out there. Obviously, ASHRAE has put out their position document. There's also REVA, there's the European ASHRAE, as well as some documents from Canadian entities, including Public Services and Procurement Canada has done a ventilation guidance. The important thing in all of these guidances is actually the base message. Before getting super excited about upgrading systems or installing new technology or doing any of these things, the most important base message that anybody should be receiving is just to make sure that the ventilation system is operating as it's supposed to be operating. And that's because in all of these epidemiological studies that have come out where there's been some hint of some sort of aerosol transmission, it's usually because there's been just a really serious ventilation problem where there was like no fresh air input whatsoever, or the exhaust grate was sealed, or there was some really serious ventilation screw up that resulted in particles gathering, usually because there was quite a few people in the space. So the really important thing is just to make sure that your ventilation system is working as it's intended to work. It's really about the room rather than the building. So a lot of people are kind of worried about the building and about the virus moving through the HVAC system to other parts of the building. There's zero evidence for that happening. Where there is evidence for something happening, maybe some contribution of aerosols to infection is at the room level. So you've got to think about the room itself. If it's crowded, you need to remove some of those people. You can't have a crowded room. And you also need to realize that although we talk a little bit about aerosols perhaps contributing to transmission, the vast majority of transmission is still happening by people being relatively close to each other and exchanging those larger particles, the droplets. So no ventilation system can stop that from happening. right? That's why we need the partitions to separate, or that's, first of all, that's why we need to reduce crowding and keep people apart, and where that's not possible, to use those barriers to catch/interrupt those really heavy droplets. Without that happening, there's no ventilation system in the world that's going to help you. So really what we're trying to say is make sure your ventilation system is working and acknowledge that ventilation is a support, it's not a solution. It's really, really important. And I think WorkSafe BC is going to be putting something out, if they haven't already. I haven't checked the website this week, but yeah, I'm always open to taking more questions. Jennifer, you can provide my email address to anybody who wants. We're happy to hear comments and queries on this subject.
Fantastic, thank you, Angela. Ira, just kind of shifting gears a little bit, from your experience, do you anticipate a surge in MSI injuries in industry because of COVID?
Thank you, Jennifer, for the question. Yeah, it is we have seen already from our member companies as well as various others who had reported several more MSI injuries they are seeing in their facility, because there are people who are working overtime at times because of the demand. As we cater to most of the time food industry and manufacturers, they never stopped working. However, they are trying to control that number of people on site at the same time, less number of people, and some are absentees. I mean, there are absenteeism at the same time. So when the demand is more, you are stressed and having this perceived threat of viruses, you are kind of bound to work more. And all of those and this altered method been adopted in the industry, and the shift changes happened. New barriers at times we have seen in our other company facilities. So that had led to increased or reported MSI or musculoskeletal discomfort problems. So there are several clients who reached to us asking about these challenges they are facing at this moment. Yep, that's definitely kind of visible in the industry for sure.
Okay, thank you. Angela, we have a couple of questions around the concept of the breathing zone that you introduced. Wondering, what's the breathing zone for in front of, to the sides of, and behind someone? And another question from another audience member is, would a face shield be adequate protection for the breathing zone?
Interesting. Okay, so the breathing zone, like I said, it's from the middle of the face, like it's the point in the middle of your skull, right between your ears. From that point, 30 centimeters around in every direction like a sphere, that's the breathing zone, or at least that's how we define the breathing zone for occupational health studies, where we're doing airborne exposures of, any kind of like toxic gas or anything else. So that's what we're talking about when we say the breathing zone. And when we say shield the breathing zone, we don't mean just go right out to the edge of the breathing zone. We mean shield it, give it the breathing zone plus a little bit of extra space all the way around. So you're trying to shield the breathing zone with a margin. The second question was about what?
Whether a face shield would be adequate protection for the breathing zone.
Yeah, so in a hospital environment, we have tens of thousands of healthcare workers who are working with COVID patients every day. And when they work with a COVID patient, they use what's called droplet and contact precautions. So the contact precautions are gloves and the gown, and then the contact part of that is the gloves and the gown, and then the droplet portion of that is a surgical mask, not a respirator, just a surgical mask and a face shield. So the purpose of the shield in that setup is to prevent droplets from landing in the eyes. It's not meant for respiratory protection, although it does intercept some particles, but it's not protecting that person's breathing zone. So I would say no, a shield is not considered protection of the breathing zone. And that's because if you are, I wish I had my diagram, but if you're within a couple meters of a person, you're standing in a cloud of their particles. And some of those particles are larger and they fall. And some of those particles are very small and they fly. But then there's kind of like this intermediate level of particle that's it's large enough to be carrying viruses, but it's small enough to be inhaled. And that's the one that we're trying to prevent people from from inhaling, so a face shield is not going to protect you from that. But there might be situations in which, like, for example, if you're doing close work on somebody, like you're a dental hygienist, I assume you would be wearing the same droplet and contact precautions as a nurse or a doctor. I have had this question, though, actually about hockey helmets, where somebody wanted to attach a face shield to a hockey helmet so that kids could play hockey. And if two children are going head to head and they've got shields on their helmets, unfortunately, those shields are not going to prevent their droplets from crossing over. Also, I have to really stress to people, be careful if you're modifying equipment or devices that are regulated. So like a hockey helmet undergoes safety testing, right? To make sure that if you crash heads together, you're not going to like shatter off fragments and hurt somebody's face. So if you're going to start modifying something like that, you need to like at least talk to the manufacturer, understand what the requirements are, and make sure you're not like invalidating a warranty or something else where you might be creating another hazard.
Okay, thank you very much. A question for Ira as well. Ira, do you have recommendations or are there guidelines for users that need to use a communal workstation or PC? I'm not sure if they're looking for ergonomic or sanitation suggestions, but in either area, what would you recommend?
Yeah, there are, because of this question is that there's a trending kind of practice in the industry now. You do hot desk kind of situation where you do work and then you kind of book that workstation and then someone else will come up and use that station. I'm sure because of that concern, because there's at the beginning of the pandemic, it was kind of identified whether that would be safe enough to do that. However, there are other kind of, as we all know now, because of if you do proper sanitization, it could be used like for several people can kind of book that prior, and then definitely you have to go through that cleaning protocol to disinfect that machine, that area or the equipment that could be used still. However, Angela could make another comment if she feels that's something she can add on to this.
Sorry, missed that.
The question was like the community or communal workstation could be used or not.
Yeah, I was actually just thinking about that. To be honest, I don't know about this because I haven't been back to the office in 5 months. We are all locked out of the BCCDC right now, unless you're lab staff, basically. So it's something where, I could, if somebody had that question they wanted to contact me, I could find out and send them back some information. So that's the best I can do for you right now. I can see like some sort of thing where you would have like a keyboard cover that would be disposable or people wearing gloves, but yeah, I could actually find out what the current recommended practice is for that.
Thank you.
But that person needs to email me, otherwise I won't remember.
Good. There seem to be, Angela, a number of questions around masks and face shields in particular, and I know that that's very common, particularly in the food processing sector. We've seen that quite a bit, the combination, and definitely in healthcare as well. So a couple of questions about whether both workers need to be wearing masks or face shields? Is there protection if only one is wearing a mask or a face shield? Any comment around those areas?
Yeah, the completely academic response to that is it depends. And so what I would say is first, WorkSafe BC has a guidance on masking. So first you should figure out what you're required to do and then look at that and like make sure that you understand the requirements. And then the NCCH, if you go to www.ncceh.ca, we have a resource page on COVID-19, which includes a lot of stuff on masking. And we have our own masking document that explains kind of like the different masks and the degree to which they protect you and prevent you from influencing others. So I would say that those resources would be the best place. Like it's quite a complicated answer. I don't know if I sent out, I did have the ncch.ca website on one of the slides, so I would refer people to that.
Okay, thank you. Ira, you mentioned a UVC task light as one possible partial solution. And we have someone asking whether those lights are potentially harmful to someone's eyes. Do you have any information on that?
Thank you for the question. I briefly have researched on that. It's actually UVC task light is for, C is not kind of harmful. So one they could do is like when the workstation is not in use, they can use that UVC light to switch it on if they are concerned, and then it could be there to disinfect, do the job, and when they come back, they can use it. But whatever my knowledge goes, UVC is not that harmful like others, but we can come back to that. If you have more questions and in detail answer, we can give that to them. Thank you.
Okay, thank you. Angela, I'm seeing a number of questions around HVAC systems again, and you've covered this in quite a bit of detail, but here I have a question from someone just looking for clarification on, you've said a couple of times that there's no evidence or zero evidence that the virus is transmitted by HVAC systems. And the question is that because there are not enough studies about this so far, whether they're peer-reviewed or not, or because the scientific studies so far have shown that HVAC systems don't play a role, or is it just that we don't know enough at this time to be sure one way or the other? Just a general comment about all the confusion around this particular area in general.
Yeah, that's a great question. Definitely, I want to say that absence of evidence is not evidence of absence, which means that we can't, and also we can't prove a negative, right? We can't prove that HVAC doesn't do it, because that would require us like trying deliberately to infect people through HVAC, which would be a little bit problematic. But I will say that we're actually writing a paper out on this right now, just trying to understand how transmission is happening. And so when I say that people are all emitting these droplets and these droplets have different risk, we know that the droplets that are closest to people, those are the ones that are most likely to establish an infection, whereas as the smaller droplets move out, it's getting more and more difficult. The probability of capturing what we call an infectious dose is getting lower and lower and lower. And so what we're seeing in the epi data, we can actually see who gets sick. If you've got a household where you have, 5 or 6 people in a household and one of them is sick, if a virus was able to easily move around through the airspace of that house, we would expect more of those people to get sick than what we're actually seeing. So currently the household secondary attack rate, which is the percentage of people in your house that get sick after you've been sick, is pretty low. It's below 20%. Sometimes it's as low as like 1% if people know how to protect themselves. So a lot of it depends on like your level of knowledge and how easily you can isolate somebody. But when we're talking about how this virus moves and whether it affects people who are close and far or just close, it's really the proximity is really, really important. So I'm not going to say that a viral particle can't get caught up, get entrained in the return air and go through the HVAC system. It could, but the chance of that particle creating an infection is nil, because you need more than one particle to get an infection. So it's in the actual epi studies, like there's really not a lot of cases in which this kind of short range aerosol transmission could have happened, but it really is short range. It really requires people to be in the same room together. We're not seeing any kind of evidence. And this is after 7 months of this virus going crazy and affecting millions of people around the world. It's not popping up in other contexts. So that said, you will have seen in the news that there's an outbreak in a condo in Alberta, the Verve condo in Calgary, and there's now quite a few people in that building who are ill, and it's going to take some solid epidemiological legwork to figure out what happened there. But again, moving through an HVAC system is just not very likely, because for one thing, that's a new building and it has in-suite ventilation, so there's no way for the suites to communicate with each other. But yeah. My very long response to that is that there's a lot of information, but from all the various different kinds of information that we've collated, there's no reason to believe that could even happen. And we need to focus on the room and interactions between people in close proximity.
Terrific, thank you.
We have to know what works, right? Like we know that in hospitals, in other settings, we know that we have the tools to stop this virus. The things that we are doing are working. And that's really important to remember when people start feeling nervous. Sorry, go ahead.
That is reassuring, thank you. Thank you. This question I think I will pose to both of you. Maybe Ira, if you could start first, and I don't know if either or both of you will have comment, but the question is, do you have any suggestions for social distancing or barrier options in employee washrooms combined with locker rooms? This company has an occupancy limit, but is still finding this a challenge.
Yeah, that's an interesting question, though. Actually, I really don't have a hands-on answer to that, but what we could see from the research that the way the virus travels or contaminate, as Angela also given several instances. So putting barrier in the bathroom, they are asking, or washroom area, or cabinets?
Yeah, it looks like a combined washroom and locker room situation. Yeah, I don't know, Angela, if you have some comment on that. Otherwise, I would mention that in a couple of our previous webinars, we have seen some examples and photographs of some of the things that that some other companies have tried here. So it's worth taking a look at those just as visual examples of things, controls that they've put in place.
Okay, one thing I can suggest, because it's when you have a number of employees and number of cabinets around you while using the washrooms, you could have definitely alternative options to not use all the cabinets or segregating them at a time, and then controlling number of people and putting notice on that how many people can use that space. But it needs lots of other considerations because we cannot see the space at this moment. And from ergonomics perspective, I could see the space and how many people are there and what kind of availability of the space and how many people could be accommodated within that place safely. That has to be kind of that needs to be observed. Other than that, right away giving a suggestion may not be appropriate. However, as we can understand that there is a minimum number of occupancy limit in this province. I think Angela can comment on that more. But from ergonomics perspective, as I mentioned, that if we could create those barriers in between alternation, in an alternation, depending on how much space is available, that could be one solution to kind of control that social distancing protocol. Another one could be, definitely communicating that through the employees or putting some notice like this many people at a time. So that could be one solution, because without seeing and kind of identifying the traffic flow from ergonomics and human factors perspective, it may not be effective. But these are the solution from the understanding of the subject. That's what I can comment on. If Angela can, then definitely she can.
Yeah, I think this is a really great example of solution versus support. So in this bathroom, the solution to preventing transmission in there is, like Eric says, is to reduce the number of people who are in there. There's just no avoiding that. And then the support to that is ensuring that the bathroom's exhaust system is functioning at or above what it should be doing. So I've seen, like, code for bathrooms is usually like, sometimes it's like, 6 to 10 air changes per hour, depending where you are. I've seen one particular ventilation expert from Pynchon, I think, recommend at least 12 air changes per hour right now in bathrooms. And so that would be a support. That's not going to prevent transmission if you've got multiple people in there or too many people in there. But if people are using that space and that space is small, COVID loves a small space, then having additional exhaust ventilation could be useful. It just depends like what ability you have. Some people, they've got on-off or they've got high, medium, low. It may require upgrading ventilation or an exhaust fan. But yeah, it would depend on an evaluation of the space. But again, the solution is to reduce the crowding, and the support is, the ventilation. Or, bathrooms have built-in partitions. They've got stalls. So I wouldn't without seeing the space, it's hard to say, but reduce crowding, use some partitions, and then exhaust the space.
Thank you both very much, and thank you everyone for your questions. We are coming to the close of the hour and don't have time to answer any further questions today, but if we missed yours, we will do our very best to answer them and provide those answers on our COVID-19 FAQ page, so please take a look there, or give us a call to talk with a safety advisor directly. Thank you for joining us today. Please do take a moment to share your feedback in the brief survey that should be in your inbox, if not now, then shortly. And we will follow up soon with a wrap-up email that includes a recording of the webinar slides and the related links as mentioned. Feel free to share those. Follow us on social media for more news, resources, and future events. Thank you again. Bye-bye.